Hello, my name is Tenny John-Idiagbonya. I'm a student of Brandman University and I'm presenting my stakeholder education plan for the DNPU 706 course. The title of my CSP project, my clinical scholarly project, is the focus is for preventing fall and fall related injuries in the elderly population that are living in the community. Living in the community is a move that is being promoted currently to help the elderly populations that to age in place and also to prevent the cost, to reduce the cost of institutionalization. Now, for them to be able to age in place effectively and safely, measures have to be put in place to promote the self-aging in place. And that is what the CSP project is about. It's about the use of a mobile app, a fall prevention mobile app, actually the Action Fall Prevention mobile app, to prevent falls in the elderly population that are living in the community. And the beauty of it is that this app is going to be used by the client independently from the comfort of their home. It will also reduce their need for frequent visitation to the hospital, so that those self-assessment, the assessment, fall assessment that would have been done by a licensed professional in the clinical setting can be done or will be done by the client from the comfort of their homes, and the generated data or findings can be uploaded to the center to use for the clients, the development of their plan of care. The stakeholders for this project, my identified stakeholders, are the primary care provider, the registered nurse, and the family representative or family member who is the daughter of the client. The primary care provider of the client is the one that acts in the role of directing the care for this client. And we have to get the family care provider to understand that the benefits of this app it's so much not to be missed. We also have to, in providing the education, the primary care provider alludes to the fact that the rate of falls among this older population is on the increase, as data also shows, and that there is a need to seek ways to prevent these falls so that their health doesn't deteriorate. So the primary care provider will be the one recommending this app for the client, and also, where needed, making appropriate prescription for its use, and also the implementation of its findings into the client's plan of care. The registered nurse, on the other hand, is acting in the role of the advocate for the client, advocating for safe and effective care for the client, educating the client on what this app entails, and also being a ready resource for the client in any way or shape or form that they have questions to be answered. And also, the registered nurse creates a collaborative atmosphere for the development of a treatment plan for this client, so that various team members consisting of from the psychologist, the social worker, the physical therapist, occupational therapist, they all come together, bringing their various discipline perspective into the development of the client's unique plan of care, of course with the client's involvement in this. And the family representative, who happens to be the daughter of the client, is the caregiver at home. Now, she will be able to bring in the family perspective also when the team meet, providing the unique needs that this client might have, and also being able to incorporate that into the development of their unique plan of care. And also, the family member she's excited. She wants to see ways that their loved ones' independence will be promoted while they age in place. The educational theory that was used is the Betty Newman's systems model. This model actually looks at is a comprehensive and system-based model that it seeks to manage environmental factors that pretty much interact with the human being, who is the core, the middle of it all. The human is at the center, always interacting with the environment and the environmental factors, the variables of the environment, with the goal of promoting wellness, wellness state for the client. There are three nursing preventive modalities that this model alludes to. You have the primary preventive level, the secondary, and the tertiary. The primary is the one that looks at how fall can be prevented, even in those that do not have the fall risk, but just going ahead and putting measures in place to prevent falls. Then secondary looks at modalities of how falls can be prevented in those that fall risk have been identified in their basically in their lifestyle or what is going on around them. And we have the tertiary, where we see those that have experienced a fall that increases their risk factors, so that their measures are put in place to see how their health to ensure that their health does not deteriorate from complications related to this fall. That would be the tertiary. The conceptual framework also looks at the human being as a total person, holistically, consisting of the psychological, the physiological, the socio-cultural, developmental, and the social and spiritual variables, all having a significant role to play in the whole person. So that holistic care is a driving force for this model. The educational intervention will be provided, it's provided for this client of the innovative model. We will have the app on smartphones available for the training, for them to see how it works, and also how to manipulate the system. The app has easy, simple questions that are easy to understand at about the 8th grade level. Questions similar to the fall assessment that they do in the clinical setting. And the smart touchscreen makes room for cognitive deterioration for this age group, so that they are able to manipulate the screen easily. The implementation of the plan, having given them step-by-step introduction, explanation on how it works, implementation will involve giving the client the opportunity to take the phone home with the app. Remember, this app is free, can be downloaded on the iOS or the Android system. They will take the app home and use it after being shown, of course, during the training. They will use the app and do a self-assessment. This empowers the client to be more independent and also involved in their care, in the planning of their care, so that we are promoting autonomy and involvement in their plan of care for the client, which is a very good thing. And at the long run also, we are cutting cost of care, because the cost of care resulting from falls and fall-related injury, it is huge, and it continues to climb. So these measures are meant to avert that, to put a stop to it, and actually help this aging population, who is the population which is on the rise, to help them age gracefully in the community without further complications that can be avoided. The RN also will be encouraged to ensure effective documentation from the beginning, so that the team can assess the documentation and also determine the plan of care that will be appropriate for this client. I hope that this has been helpful. Thank you.